Hello, this is Dr. Hausinger, and we're going to be talking about screening and assessment. Please note that we do go into a lot more detail about this in 401. As with the rest of your book, this chapter focuses on the strengths perspective. The assessment is very comprehensive, and it's a way for the counselor to get information, establish rapport, see if it's a good fit. Remember that we don't want to cookie cutter everything for the client. We want to fit the services to the client instead of fit the client to the services that we have. So referral can be important here. We do have to give diagnosis in order to reimburse insurance. It's part of managed care. Disadvantages include setting up false expectations for specialized treatment, delays in the actual treatment, especially if we're looking at inpatient, and the standardized treatment that we have might be inappropriate for many minority groups. So one of the first things that we do is screening, and the difference between screening and assessment is that screening is short and brief, and assessment is very long. So it's just a few questions to determine the nature of the help that's needed. They're usually informal questions. Do you sometimes drink? And they can be, there's a lot of screening tools that are geared specifically for women and minorities that are more effective than other screening tools. So an effective one question screening for women might be, how many times in the past year have you had 4 or more drinks in a day? And we might get a different answer there too. So remember that we have a difference between binge drinking and drinking not to intoxication. So CAGE is a very popular one that's used. C, have you ever felt that you ought to cut down on your drinking or drug use? A, have people annoyed you by criticizing your drinking or drug use? G, have you ever felt bad or guilty about your drinking or drug use? E, have you ever had a drink or use drugs first thing in the morning to steady your nerves or get rid of a hangover? Okay, so here we actually have some of the ASAM criteria. Being able to cut, have you ever cut down or tried to? Has it affected relationships? Right, have you ever felt bad or guilty? It could be dimension 3. Another one is tweak. Looking for tolerance. Are people worried about you? Do you have eye openers? Is there any time that you can't remember because you used? And have you tried to cut down? This works well with mixed ethnic populations, and it's very similar to the CAGE. The audit is recommended by the World Health Organization for global use. It includes 10 items that cover the amount and frequency of drinking, alcohol-dependent symptoms, personal problems, and social problems. So again, looking holistically. An example would, have you or someone else been injured because of your drinking? The scoring for the audit tool discriminates between the different levels of risk, hazardous, harmful, and possible dependence. So we have our spectrum represented. It can also be a prevention tool to assess further risks. It can be given to the client as a questionnaire to fill out, or it can be used as an interview question. So some of these can go both ways, and you can find it on the internet. So once we screen somebody and determine that it would be a good idea to have an assessment, then we're looking at assessment tools. Assessment is defined as the process for defining the nature of the problem and developing specific treatment recommendations for addressing the problem. It can give a deeper picture of motivation to change, and it can be the beginning of the therapeutic relationship. Gamblers Anonymous has 20 questions to determine if someone has a problem. Some of these examples are similar to the alcohol questions. Did you ever lose time from work or school due to gambling? Has gambling ever made your home life unhappy? Did gambling affect your reputation? Have you ever felt remorse after gambling? Did you ever gamble to get money with which to pay debts or otherwise solve financial difficulties? We have the drink inventory, and this was originally designed for Project Match, of which your book talks a lot about. It's a 50-item questionnaire that covers physical, social, interpersonal, impulse control, and interpersonal problem areas. And It's been used for a long time and has proven reliability and validity. It includes positive questions such as how often has drinking helped me to relax, and negatives such as how often has my ability to be a good parent been harmed by my drinking. So, pretty close to motivational interviewing. We have the SASI, which is the Substance Abuse Screening Inventory, and there's an adolescent version as well. It's very expensive. This is something that's not available for free. It's a different approach to assessment instruments. It doesn't ask directly about substance misuse on one side of the form, and it consists of true or false items such as I am often resentful and I like to obey the law. And one of these things that we look for in screening is the level of defensiveness, right, of the person, which could help us with figuring out the stage of change and looking at dimension 4. So we have different levels of care, LOC. We assess in 6 different dimensions, and then we place people into a level of care. Early intervention, which would be something like alcohol drug information school, right? Or a diversion program for youth, outpatient programs, intensive outpatient / partial hospitalization treatment, residential / inpatient treatment, medically managed intensive inpatient treatment. This would be your detox and stabilization. Each level of care includes several different layers of intensity. So outpatient could be weekly, it could be monthly. Now, this can get a little confusing. Residential and inpatient, this might mean different things in different parts of the country. Okay. So as we are always continuing to move towards integrated care and looking at how we can best serve our clients, we have to look at co-occurring disorders. A basic program from the CSTAT provides treatment for one disorder but screens for the other disorder. So if you are a chemical dependency professional or now substance use disorder professional, and that's your only credential, you can't diagnose. You can't diagnose for mental health. You can diagnose for substance use, but you can't diagnose for mental health. And so that is where you can screen and do a referral. Right? An intermediate level focuses primarily on one disorder, but also addresses some specific needs for the other. And an advanced level would provide services for both disorders. And again, this is going to depend on your credentials and the scope of practice. So looking at guidelines for the assessment of co-occurring disorders, it's important to be familiar with the latest DSM and the criteria for diagnosis. We are in the DSM-5, which came out in 2013. It's important to keep up to date on the relevant psychiatric medications. Trainings are usually not very expensive, and your agency might pay for you to go to trainings. Sometimes your school program, we might be able to go to trainings, or there might be programs for us, or your internship as well could send you to trainings. Harm reduction therapists recommend only contacting family members and others if clients so wish and with the client present, right? And then we get into the legality here of the release of information, the ROI. So a client could have an ROI in file and then decide to get rid of it, and then that's their right. Okay. And it's important to talk to your client about what is going to be disclosed to their family members or others prior to that conversation. And it's also important to know the community resources, which change. Okay. So in looking at older clients, we have risk factors for gambling, which are the presence of current post-traumatic stress disorder symptoms, having a minority race or ethnicity, and being a veteran affairs patient, so VA. It's important to include questions about gambling, and every place that I've been to, they have a gambling screening also, and then it's a preliminary screening, and then there's a secondary one if the preliminary one yields that there needs to be the secondary one. The MAST is the Michigan Alcohol Test, which is evidence-based and has been used for many years. It's another popular one. What you're going to see is usually most places are going to have 2 to 3 screening tools before the assessment. And there are versions of the Cajun MAST for older adults. just as there are versions of adolescent tools just for adolescents. So we want to assess for strengths. And part of what I feel is our job is we help to find the strengths when the clients are hopeless and can't find their own. So we want to view clients in a collaborative light and as in charge of their own goals. We want to take into account social factors as well as individual factors for a comprehensive view of the situation. Move the assessment towards strengths, both interpersonal, so their motivation, emotional strengths, and ability to think clearly, and interpersonal, which would be their family and their networks. And we do want to avoid identifying the person with the label. So when I do assessments, you do have to tell them the diagnosis, and then you explain why. And it's important to do this in a very strength-based way. Where, you know, you probably don't want to say, "Congratulations, you're an alcoholic." You could, I guess. But you want to say, this is the results of the assessment and my diagnosis because you have X number of the criteria. And then you talk to them about the treatment plan options and what you would recommend. And sometimes they'll be okay with it, and other times they might want to get an assessment someplace else, which is their right. Okay, so in a strengths assessment, our key ingredients are empathy, which according to Miller and Rollinick is the number one determining factor of whether or not a client views therapy as being helpful. Provide hope and offer reflective listening. Okay. It is important for assessment forms to be sensitive to gender and cultural differences. And when you get to 401, we do an assessment, and you'll notice that the language on the form that we use through the Thurston County Drug Court is very inclusive. Okay. And we do need to update our forms because times change. It's important to look at language differences. The word craving can be difficult to translate, so especially for in diverse areas, it might be advantageous for an agency to have multilingual or bilingual individuals and have a translator on hand, or also have the documents translated into different languages. Okay. The cage and tweak work particularly well with women. And again, have you tried cutting down? Have people annoyed you? Have you felt guilty about your alcohol or drug use? Have you ever used alcohol or drugs as an eye opener? Okay. There's other screening forms as well. We talked about the audit, which was developed by the WHO for alcohol use. The NIA has a 50-item instrument, the Inventory of Drug Use Consequences, within the public domain. And the WHO has designated areas of harm caused by drink, physical, emotional health, family, finances, etc., which can be helpful. All right. One resource that I really like is the ADA website through UW, and you can search through hundreds of different screening and assessment tools, and there are some that are free to public domain. Thank you.